Now, Bipartisan Policy Center has released a new report and convened a high-level discussion which brought together senior U.S. government officials, including some of the pioneer champions of PEPFAR. They discussed 15 years of PEPFAR and why the U.S. should continue investing in global health. For more on that discussion, I'm joined in studio by Faustine Wabwire, Senior Manager of Policy and Advocacy at Management Sciences for Health. Ms. Wabwire, welcome to Africa 54.
Thank you. Glad to
be
here.
The last time we saw you here, you were kind of affiliated with another organization. You are now with MSH. Can you just briefly tell us what that is?
Great, absolutely. I currently work with Management Sciences for Health, or MSH. And MSH is an NGO, a not-for-profit organization that's dedicated to strengthening health systems around the world. MSH uses an integrated approach towards health system strengthening. On one hand, we work to provide health services, testing and diagnosis, and on the other hand, we focus on strengthening the drug supply chain so that patients have access to better medicines at an affordable price.
So definitely you have a lot of interest in PEPFAR. Why? We turn to PEPFAR. Why is PEPFAR such a special program?
You know, there is so much that we can learn and have learned over the years, the last 15 years of PEPFAR's existence. As you may recall, in the year 2000, when President Bush initiated the PEPFAR initiative, the scourge of HIV was spiraling out of control. And on May of that year, 2003, Congress authorized the largest ever investment in a single disease in the U.S. global health engagement. And so PEPFAR over the years has demonstrated strong bipartisan support, which speaks to a lot of the progress that we've managed to see concrete impact on the ground where PEPFAR works.
Many people have been concerned about the state of PEPFAR at this moment as we speak. Is there any reason why people should rally around PEPFAR, particularly at this time?
Absolutely. And I think just to give you a sense of where we've come from and why this is important to sustain progress on PEPFAR, recall that era, just a decade ago, when HIV wiped out entire villages. President Bush's response to the human suffering at the time, which he referred to as a work of mercy, was to really help save millions of lives, but at the same time also, outside of the moral imperative of saving lives, build stronger communities. Healthy individuals contribute to economic growth, to global stability that we all benefit from, and our shared prosperity as a global community.
Now, I'm holding two reports here, and one of them is from your organization, MSH, Healthier, Stronger Health Systems, Healthier Families and Communities, and also the one that we just mentioned that was released, Building Prosperity, Stability and Security Through Strategic Health Diplomacy. Now, both of these reports, one of them that was launched on Monday, seem to speak of the need to invest in PEPFAR. Up to this point, though, someone would want you to make a case why there should be that continuation.
Absolutely. I'll speak to the unique approach that PEPFAR has demonstrated over the years. One of the unique things about PEPFAR is that it applies a shared responsibility approach, meaning that donors, affected communities themselves, partner countries, the private sector, all come together to form innovative partnerships that have over the years seen a cost-saving effect. So just to give you an example, in 2003, for example, PEPFAR was paying an average of $125 per person for a month's supply of life-saving HIV treatment. Today, that cost has been brought down to just $6 per person per month. And that's because of the innovative financing mechanism that exists, but also the partnerships where communities also fit into what works and what doesn't work. I think that makes a strong case for why PEPFAR is important. There are other benefits too in terms of economic growth. The report that was released by the Bipartisan Policy Center actually shows a series of analyses that indicate that where PEPFAR investments have had greater effects on economic growth compared to countries where there have not been similar investments, but the HIV burden is high.
Investment, money, very critical. Congress is in the process of making now important budget decisions for year 2019. Question is, what's the future of PEPFAR funding? Many are asking in this city.
So that's what's really important. I think as we engage and talk about the success of PEPFAR and the need to sustain this progress, what's important is that the legislation that authorizes PEPFAR goes through fiscal year 2018, meaning it ends on September 30th of this year, 2018. Congress will need to reauthorize PEPFAR to give it the mandate to continue to create the impact that's gone beyond just the countries where it operates, beyond the communities, towards strengthening economies. Countries that are becoming trade partners with the United States, we all benefit in our highly globalized economy.
And indeed, a conversation that should continue. I want to thank you very much, Ms. Wabwire, for joining us today.
Thank you.
Now, Faustine Wabwire is a Senior Manager of Policy and Advocacy at Management Sciences for Health.